Good morning. My name is Angela Lloyd, and today we are discussing the role and responsibilities of community health and public health in our community. In addressing healthcare professionals, the purpose of this presentation is simply to enlighten you concerning your roles in community health and public health services. This presentation will focus on the following areas. We will define community health and public health as well as define their roles in ensuring individual health and well-being. Briefly, we will review the organizational structure of the U.S. public health system while examining the legal and ethical concerns of its structure. We will also examine community health and public health's role in communication through community programs, as well as analyze the funding of these departments and services in an effort to ascertain if it is adequate and reasonable. What is community health and public health? Well, let's start with public health. And public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort for the sanitation of the environment, the control of communicable infections, the education of the individual in personal hygiene, the organization of medical and nursing services for the early diagnosis and preventative treatment of disease, and for the development of the social machinery to ensure everyone a standard of living adequate for the maintenance of health. Whereas community health is the health status of a defined group of people and conditions to promote, protect, and preserve their health. What is the role of public health in the well-being of populations? Well, as defined by the Institute of Medicine, it is what we do as a society collectively to ensure the conditions in which people can be healthy. Now, what is the role of community health in the well-being of populations? Well, according to the World Health Organization, it is a combination of science and skills and beliefs directed towards the maintenance and improvement of the health of all the people through collective or social actions. Oftentimes, community health issues arise around social injustices. And we'll delve further into that the deeper we go into this presentation. In order to understand community health and public health's role in communication through community programs, as well as the legal and ethical roles of community and public health structures, one must first understand the complex network that join these areas of health. This chart of components of the U.S. healthcare system shows the areas that public health covers. We see that federal agencies are at the top. These agencies are government organizations such as the CDC, DHHS, or CMS, but they encompass other agencies that we may not think of, like the FDA, the U.S. Department of Education, or the Department of Agriculture, Department of Homeland Security, and even the Environmental Protection Agency. In the event of a public health issue, both the U.S. and abroad, these agencies and others like them will be the first level of response. But beyond their response in times of disaster, outbreak, or general health threat, these agencies are charged with actively researching and facilitating programs and policies and even laws to ensure the safety and health of the public. The second level of public health is where the objectives of community health combine with public health. The three different components are: first, state, tribal, local, and territorial agencies. These would be departments such as the Department of Health, the Office of State, Tribal, Local, and Territorial Support, or even the State Emergency Management Agency, sanitation services, and water treatment facilities. The next component in this level is government agencies other than public health, like Administration for Children and Families, Homeland Security Department, or even the Department of Housing and Urban Development. The third level the third component in this level is the clinical delivery systems, which would be varying levels of medical service providers. This includes clinicians, pharmacists, DME suppliers, and manufacturers. This encompasses many of us in this meeting today. The third and final level, which is the widest level encompassing many areas of community health, is comprised of a combination of public and private entities, the first of which is the media. This includes social media and web based campaigns concerning health related concerns and messaging. The next component is community based organizations, such as the World Health Organization's Family, Women's, and Children's Health Program, Hands On USA, or Neighborhood Works America. The next component in this level is private nonprofit associations, such as AARP, AGS, Foundation for Health in Aging, the American Cancer Society, or the American Heart Association. The fifth component in this level is educational institutions like Tulane University or Emory University, both of which are leading research and teaching institutions of higher learning. The final component in this level is private industry. This encompasses industries such as prevention research centers like UNC and Emory, who work very, very closely with the CDC to develop new treatment and new strategies for different outbreaks, as well as companies like Coca-Cola and Pepsi, or even McDonald's. These components combine to represent the entire realm of public health and community health. And in illustrating the types of organizations that make up these components, we see that each entity in its own way serves the overall objectives of both public health and community health, which is to prevent disease, prolong life, and promote health. But all of this begins with the communication of this mission and finding the balance between the law and ethical responsibility in public health and community health is a challenge, but it is not unattainable. Public health officials not only help to create policy and to create laws, but they also implement them and oversee their processes. As healthcare professionals, we work within the realms of these policies and procedures every single day. We work with them in the form of CMS, and we work up with them in the form of the policies and procedures as instructed by the Joint Commission. Therefore, the legal concerns of the U.S. public health system is something that we are very familiar with, and we don't really need to discuss in great detail. But ethically, community and public health is a balancing act between the commitment to human rights and social justices. This is a delicate dance of ensuring human rights issues, such as the provision of clean water or ensuring the massive availability of health services, are tempered with the creation and recommendation of laws and policies that ensure these rights. The uninhibited, clear mission of public and community health must always be the focus of any communication to the public by community programs and their directors. As healthcare professionals, we have an obligation to also embody and effectively communicate public health missions and visions that the general public really doesn't share. For we are on the front lines of these policies and procedures, and our actions give life to these ideals and practices. Therefore, it is crucial that we understand the essentials of what it means to be healthy and our responsibility to help others realize it. Healthcare professionals overall understand that public health interests, while similar to community health interests, address a more diverse grouping. Public health officials, on one hand, must contend with the needs of a nation as a whole, while community health officials must protect and address those things that directly affect their localities. And there are times when a national need may conflict with a local interest, and this is where proper communication
As of
and cooperation is
2012,
crucial among the two
the cost of
systems.
health
But
care
as long
is
as the overall mission
17.9%
is
of the
followed by
US
both community
GDP.
and public
What
health
this means is
leaders,
that we
we can
spend
always
over
work together in response
$8,000
to any
per
situation
citizen.
of the United States on their health care. This funding comes from various areas, but primarily it is funded through taxation. Therefore, it is a moral and ethical responsibility as well as a fiduciary responsibility to make sure that everyone is experiencing the level of health that they are entitled to. In conclusion, as healthcare professionals, it is the responsibility of each of us to embody the mission of public health. And we do this through community health programs as well as the service that we give in our communities. Each of us are soldiers in the war on disease, death, and despair. Many of us care for patients in healthcare facilities, but all of us touch countless others who we can influence to care about their health and the quality of it. This presentation was designed to arm you with the tools of information that should transform your understanding of the basic policies and procedures you follow daily, from bland rules that govern to the foundational devices needed to create a healthier community. Laws like the PPACA only go so far in helping the public attain and maintain a healthy state of being. Wellness does not begin and end with the absence of disease. Instead, it is an entire system created to yield a layer of protection and order directed at maintaining overall health. Healthcare professionals like us often only focus on one aspect of public health, which is to treat and prevent illness or disease. But today's presentation illustrated that our role in public and community health is much, much greater. We must be at the forefront of issues such as the preservation of the environment, as well as cleaning the environment, climate change, poverty issues, socioeconomic segregation, as well as core social issues such as gay rights, gun rights, child abuse, and domestic violence. Additionally, we must focus on research and development of new medicines and treatments for chronic illnesses such as cancer and HIV/AIDS research. Now, this may seem to be an overwhelming task, but it clearly is not, because our role in public and community health systems is pretty much spelled out. The system allows us to focus in areas of greatest concern to our regions, but we can push ourselves to go further by volunteering in our communities for those things that will help bring a change to our current conditions. I hope this presentation has been both informative and inspiring. And for additional information concerning public health and community health programs, please check out www.healthypeople.gov. Thank you.